Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we're going to talk about keratosis pilaris. Keratosis pilaris is a very common condition of the skin that causes bumps, often on the backs of the upper arms. That is the most common location for this rash. Some people call it chicken skin. It's extremely common. I'm sure you know somebody who has it, or you may have it yourself. It usually starts in childhood, and people can outgrow it, but it can take many, many years or decades for that to happen. It does often run in families, and it is often but not always associated with eczema, asthma, and allergies such as hay fever. Many patients will have it all over their arms, legs, back, and abdomen, and some patients get it on their cheeks. On the cheeks, it often looks a bit different than it does on the body. On the cheeks, it can be very red. While it can sometimes be bumpy on the cheeks, it is often the redness that is more common. Keratosis pilaris on the body can also be red, and in some patients who get very inflamed from it, the red can turn to brown and become very discolored. Keratosis pilaris is caused by a buildup of keratin in the hair follicle, which causes the bumpiness. We do not know why this happens. However, the redness is due to inflammation, and the brown discoloration is from post-inflammatory hyperpigmentation. Many patients have had keratosis pilaris their whole lives, and it does not bother them, and my favorite treatment is to do nothing about it, since it is not curable and it is hard to make it better. But for some subset of patients, the keratosis pilaris is very bothersome, and they want to treat it, and I'm going to discuss the treatment options here. As I often like to say, generally speaking, big problems, big results, small problems, small results. And this is very true with keratosis pilaris. If a patient has a severe case, I can make a big difference. But if their case is mild, there is less room for improvement. The first thing to do to treat keratosis pilaris is to try to smooth out the bumps. This can be done with over-the-counter amlactin or lachydrin lotion or cream. These are specific brands that have chemicals in them that can help smooth out the skin, such as ammonium lactate. In my office, we also carry a glycolic acid body lotion that can help a lot, and patients will use the over-the-counter once a day and ours once a day, and these work well on smoothing out the bumps. These are great creams for the body, but on the face, sometimes they are too strong. On the face, if it's bumpy, I will often recommend a mild retinoid, such as Differin, either the over-the-counter or prescription strength, or Retin-A or retinol. These can also be used on the body, as well as the cheeks, a few times a week to help smooth out the skin. Another way to smooth the skin is to use a mild exfoliant of sorts in the shower. Some people take a washcloth and rub a bit on their arms or legs, or a mild scrub in addition to the cloth. If this works, that's great, but it also can be irritating, and there is a fine line between making this rash better and making it worse. So I always recommend to be very careful with this technique and to only do it once a week or so, if at all. The last way that I like to help smooth the bumps is with chemical peels, which work well for this condition. They are another way to gently exfoliate. I do these in my office. There is no downtime from them typically, but any of these treatments have to be done on an ongoing basis as the condition continues and is not cured. Once the bumps are smoother, then we can tackle the red spots. Not everybody gets these, but if a patient has them, they can be very bothersome. Luckily, these red spots respond well to laser, such as a pulse dye laser like the V-beam. There are other lasers that would also work, such as a KTP laser. Any laser that works for reducing red will work well here. But it's important to understand that any treatment will need to be done over and over again as the condition is not being cured, it's just being managed, so we need to repeat the laser periodically. Lastly are the brown spots. Not everybody gets these, but again, if somebody gets these, they can be very bothersome. These respond very well to glycolic lotions, retinoids, chemical peels, as well as sun avoidance and sun protection. Brown spots get much darker in the sun, so it's really important to wear sunblock and reapply. There are other chemicals I also like to help fade brown spots, such as azelaic acid. There's also Cispera, which is an at-home fading treatment that we can use for 15 minutes a day for 4 months or so. This is a good alternative if the patients cannot come in for chemical peels all the time. There is a whole podcast on the treatment of hyperpigmentation, so you can listen to that if you would like more specific information on fading brown spots. So in summary, for keratosis pilaris, the important thing is for me as the doctor to figure out how much it bothers the patient. It is a benign condition and it will go away over time, although it can take many years. If it does not bother the patient, then we do not treat it. But if they want to treat it, it's a 3-pronged attack of helping reduce the bumps, fading the redness, and fading the brown spots. I do have a lot of success treating it, but it takes many months and many treatments to make it better. So it really has to be a motivated patient who wants to spend their time working on this issue. I find that it's common to want to make it better for weddings, for example, or for summer months, but many people often find a happy balance with their keratosis pilaris. And remember, if you have it, you will eventually grow out of it. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.